In the lung also there are blood vessels are there, lymphatic channels are there, they are having some kind of like a bronchus, bronchioles, they are splitting, and that impression making that particular thing which is looking like hazy. So, we call them as bronchus and vascular, we call them as bronchovascular markings. So, these things we are seeing there on going on different directions, these things looks like a root of a tree, narrow things we are seeing that, these things are we call them as bronchovascular margin. More you go from the mediastinal region to these peripheries, these markings becomes faded. Here you see that this is quite dense, right? So, this region of the lung will be corresponds to the what part of the lung? The door of the lung. The door of the lung we call them as hilar region. So, this region we call them as hilum region of the lung. So, this region bronchovascular white part is more dense. Compared to that, as you move to the peripheries, the white part becomes little fade and black part becomes predominant. So, these bronchovascular margins or markings are more pronounced in the central part or in this mediastinal part. As it goes over there to the margins, it becomes faded. That is a normal thing, right? So, because it was bigger, then you are branching in the smaller branches. So, the bigger bronchovascular blood vessels and the bronchus are making a good impressions. Once it becomes narrow, small one, these images of that bronchovascular margin becomes thin. That is why it is moving on the lateral side, it is becoming more black than that of white. So, this is the normal shadows that you are looking at. So, once you have seen these particular regions of these particular regions markings over there, then you can see this particular midline part. Here as well you can see this. So, this shadow corresponds to heart with what? Pericardium, heart with its covering. This is what you are seeing here, pleural cavity where you see the lung along with the pleura as well. So, the things are there. So, here we are seeing the heart with the pericardium along with the blood vessels or great vessels that you are going to see. So, this region is mediastinum and these are a pleural cavity where you see the lungs along with these particular pleuras along with the bronchovascular markings are there, right. Now, if we move above over here, you see that these shadows which is present in the midline look like little black shadows intervene, right, little black. So, what structure will be here? Trachea. So, this trachea contains air. Does it contain air? Yes. So, this light black part which you seeing here because of the trachea which is present in here. So, this is gradually coming and breaking down to right and left principal bronchus and entering into this lungs through that door, the hilum, and getting in. So, this is what you are seeing here. Now, you decode this particular thing BV, that means bronchovascular markings. These bronchovascular markings becomes more prominent here and it becomes faded as it goes on the margins. This is normal thing. Understand why it is faded on? Because it becomes branched and becomes smaller. More it gets smaller, the impression is less. So, it is more penetrated. Clear? You find the logic? Okay. Then, this shadow what you are seeing here black is because of the TS, tracheal shadow, which is going here, over here. This is the mediastinal shadows, which is present in it. This C1 is the clavicle, right? So, this R1 is ribs. You see that rib markings? Right. So, whenever you are counting the ribs, we count it from this side like this. So, from this end, we count it like this. So, it's counted in a reverse order. We cannot count it like this. So, counting of the ribs, if it is required, you count it from this shadow following this, like this, in a reverse direction, like this one, not this following this one, right. But those things are complex things. Later on, as you grow like in a higher med, you learn them. Now, in this particular lung shadows, you see that this is the pleura that is covered with, and the lung shadows there is 2 points over there, which you call them as recess. There are 2 spaces are there, 2 angles are there. This is one angle, this is another angle. So, this angle we call them as Costomediastinal recesses, CM, and this one is Costodiaphragmatic recesses. So, this one is Costodiaphragmatic recesses where he is representing over here, and this one is represented its Costomediastinal recesses. You understand the recess? That is a space. What do you mean by the space? We call them potential space. Where exactly the space is there? This particular space is there between the layers of the pleura. It is not inside the lung. It's this particular space is present between the layers of the pleura. What are the layers of the pleura we have? Visceral layer, parietal layer. So, between the visceral and parietal layer, this tiny space is there. Now, this particular space is visible? No, not visible normally, unless until something accumulates in it, then it becomes like this. So, this particular angle or radiogram shows this particular angle, but whenever you are going to see this in normal cadavers or normal individual during surgeries, these angles are not visible, or this particular space is not visible in that sense. So, the costodiaphragmatic and costomediastinal recess, these are the two things. Now, if you have some disease where you see that fluids are starting to accumulate, what means by the fluid? That means pus. That means if you have some kind of infection, it is accumulating pus. If you have some kind of trauma, blood is getting in, so the blood may accumulate. It is also a fluid. If you have some diseases which is shedding this particular pleural region, we call them as effusion, fluid accumulations, which is a clear kind of fluid. So, that particular fluid, if it is accumulating, this particular space will be holding that fluid. So, out of these two spaces, costomediastinal and costodiaphragmatic, that means CD and CM, you look at them. So, which one is lowest in position? CD. So, where the fluid will be accumulated first? Because of the gravity, it will be accumulated at the bottommost. So, if you have little amount of fluid, say for example 50 ml, where the fluid will be accumulated first? CD. Then if it is grows bigger, becomes 300 ml. So, then it will be CD plus because it is started to accumulate. You understand, get the logic? So, if you have this particular part is not visible, CD is not visible, this angle is not there. So, we call them as costodiaphragmatic angle is absent. That means, you cannot see this sharp angle. You can call the angle, this one is also angular, this one is also angle, this one is angle. We call them as loss of angle, loss of CD, CD angle. You understand? This is a technical term that we use. Then you have to understand what do you mean by the loss of CD. That means, we have that angle lost. That angle loss means something is accumulated. What could accumulate? Fluid. What the nature of the fluid be? It could be blood, it could be pus, or maybe clear fluid, or maybe it may have lymph. So, depending on it will be accumulated there. So, if it is a little amount of fluid, if it is just begin to appear or just begin to accumulate, where are you going to accumulate first? The lowest most bottom, tier 1. So, tier 1 is CD because that is the basement. So, it accumulates at the basement, then moves to the ground, then it moves higher up, right. So, it gradually moves up as it becomes more and swells up in amount of the secretions. Clear? So, this is how we understand this particular problem. We will show some pictures where you see that loss of CD and loss of CM, then you understand what do you mean by that. Clear? So, this is what we are going to see. This is a cardiac, this is a skygram which is emphasizing on this particular lung shadows. Clear? Now, out of this, I will remove this lung and then I will be emphasizing on the cardiac shadows. So, I will be identifying the borders of the heart. Today, we learned these borders of the heart. So, we have learned that borders of the heart. How many borders we have learned? 4 borders are there. Superior, right, inferior, left, right. So, in the skygram as well, we are going to see these cardiac shadows. See that? So, it has got different colors on it. So, now I am highlighting, emphasizing on cardiac shadows. So, you see that the cardiac shadows can be differentiated. We have this particular diaphragmatic border, we have this right border, we have the left border, and imagining that particular region, we may have this joining these two, we get the superior border. And then on the superior border, you see a red bump, looks like a knuckle. Bump, this bump we call them as AK, not 47, right? So, this AK is aortic knuckle. What do you mean by aortic knuckle? So, we have this great vessel aorta, and what happens with the aorta? It has 3 parts. So, we call them as aorta is the beginning part, then it arches and then drops down, right? So, we call them as ascending aorta, then arch and then drops down, descending aorta, descending thoracic aorta. Clear? So, as this aorta is crunching on, as it is making a bend, that particular bend radiologically looks like a knuckle. So, that bend you are looking where this particular aorta is transforming from this arch, that means arch of aorta to descending thoracic aorta. So, we call them as AK, aortic knuckle. So, it is knuckling down. So, if you look at this particular picture in here as well, you can see this, right. So, this is what we call them as aortic knuckle. Now, if this knuckle you are seeing is normal, it should be like this. If you see that this particular knuckle is big enough or little bit bulge up, we call them as opening of aortic knuckle. Man means it is getting bigger. So, that means this arching of aorta is becoming something wrong with that. So, this much of aortic knuckle, with your training with your eyes, you said alright, this much is fine. But if this knuckle becomes like this, we call them unfolding of aorta. That means knuckles become bigger. So, this unfolding of aorta or arch of aorta is a sign of disease. Okay, but we are not going to learn the disease. We are just learning the normal thing. What we are going to learn normal things? The borders of this particular heart that you can figure out here. So, this border will be roughly right border. This border will be roughly this one and this one, and joining them we will find rough area which is clear. So, this is how we are going to decode this aortic regions or this mediastinum which is related to the heart. Clear? So, whenever you are getting this particular skygram picture, plain X-ray on the thorax region, we are going to learn the soft tissue shadows that has got two parts, cardiac region and as well as thoracic region, and as well as the bony part, bony shadows are there, right. Lot of things, lot of material, looks like pretty easy, but not easy. So, this is how we are going to talk about this particular thing. Now, coming to this particular thing which is together, like these are the lung fields, aortic knuckle, this particular heart shadows or shadows of the diaphragm, everything together is present in here. Now, this view you are seeing here, what kind of view it will be? It's lateral view. It's classical lateral view. Do you see that? No, it's not classical lateral view. It's a little bit oblique is there. This one is classical lateral view. So, it's a straight lateral. This one is lateral, all the way lateral. The person is standing and this picture is taken all the way. Yes, this is something we are seeing at little bit tilted or little bit like angled. We call them as oblique view. This kind of views, we take it from the sides to visualize something else, but this is not the normal thing. The lateral views should be ideally like this. So, once you see these lateral views, you have to place it, which is the anterior side, which is the posterior side. So, which is the anterior side? This is the anterior side. This is the posterior side, right? These shadows, what you are seeing here, this region, hilum of the lung, the sides you are seeing here, of the sides. This side is sternum, this posterior to that, behind the sternum, retrosternal space, also known as this anterior mediastinum. In radiology, we call them as retrosternal, and this one is behind the heart, we call them as retrocardiac. Now, once you see this, you can understand this particular black shadow is because of this. Black shadow is for the lung shadows. This region is corresponds to the cardiac shadows with pericardium. Clear? And this region you seeing that with this thing, you see that these are the bronchovascular markings. This is what same thing we are seeing. So, having said that, move to this particular skygram plates which is present on that, then you can identify, or else okay, let me have this particular special X-rays as well. So, this is what we are seeing here is that this is not special, this is a diseased lung. So, this view you are seeing here, anteroposterior view of the thorax. What you are seeing here, right side and left side lung or shadows are there. Both of them are identical, same? No. Right side looks like good, normal. Left side, something is missing. What is missing here? CD and CM. So, we call them as loss of CD and CM. Why it could be lost? Something is wrong with that, right? What could be wrong? Fluid, pus, or maybe some mass is there, tumor occupying there, making these white shadows like this, could be. So we call them as loss of CD and CM, and we need a better visualization. So this is how we are going to talk about. So this angle visible. Here we see that? No. It is the cardiac shadow is also there and partly missing with the left border because of the loss of CDs are there. This angle visible? No. So you see that? We have a fluid accumulation in a disease condition out there, right? Now, this is again another thing. What do you think that this is? This is normal or not normal? Normal, not non-normal, right? So we have this right side normal, left side is not normal. So we said this particular region is having black shadows. This much of lung tissue is visible. Rest is all white. But you see that this marking is having a straight line. A straight line is there. That means the fluid and air level having a straight line which is present in this region, which leads to having some kind of feature. We call them as collapse of lung has happened, and that has created a line over there because there is a air and fluid level is there, which is having this particular problem. But anyways, what we have to understand the difference between these angles present properly, this side no angles. Now this is what you are seeing here. Mediastinal shadow looks odd, right? So why is the odd part over here? Do you think it's a heart? Yes. You see that? This heart shadows which is enlarged. It could be enlargement of the heart. It could be enlargement with the heart with the pericardium. How does it look like? It looks like a pitcher. कलछी की बोले हिंदी में क्या कहते हैं? कलश. बढ़िया है, मेरा हिंदी बढ़िया है. So it looks like a pitcher. So looks like a water bottle. So water bottle shaped heart, which is a hallmark for accumulation of fluid. In case of the heart, where the fluid accumulates, in case inside of this pericardium, and this clinical condition we call them as pericardial effusion. If the fluid accumulates in the pleural cavity, we call them as pleural effusion. So fluid in the pleura, fluid in the pericardium. That could be a problem out there. So we have this enlargement of the cardiac shadows that is visible. How about the angles present in the lung? Clear. So we have this clear angle. So no problem with the lung. Bronchovascular markings are prominent, visible. So no problem whatsoever. So this is how we are seeing that abnormal things. But the abnormal thing is not for us. But unless until you know that these things are abnormal, how it can turn be, we can compare it with the normal things. Alright. Now you are seeing something special out here. Now before that you are seeing some markings out here. See that? These markings you are seeing here just like thin lines. Now if you are seeing them prominent in this region, really understand, follow the bronchus, that means you must have done something special to it. So this is a special X-ray where you have put a dye in it and then you click the picture. We call them as bronchogram, where you have put a dye, and that after the dye is reaching that particular point, we take the picture. Then we get this bronchogram. That means bronchus are visible. You see that this branching of the bronchus, this is one, this is another, this is third. So right lung have got three bronchus, principal bronchus. Then it splits into segmental bronchus. Then it is bronchioles like on. So it is splitting into branches. In these normal diagrams, can you see that? No. You can see that clearly in this. So you are seeing something special, isn't that? So what kind of X-ray it is? It's a spatial X-ray. And what exactly you are seeing in here? The bronchus or the branching of the bronchus. So it's kind of a bronchogram. Clear? If you are going to see some arteries, what are you going to see that? Artery inside, we call them as arteriogram. You are seeing what? Aorta. So you see the vivid parts of the aorta. Before that, what you used to see? Knuckle only. Here, what you are seeing here? In and out of an aorta, ascending aorta, arching, descending, and branching of it as well. See that? How come it becomes possible? Unless until you spend some money. You're spending money on putting a dye. Give some ornaments to it. Glows. So this is how we call them as spatial X-ray. Showing something, you are seeing bronchus? No, you are seeing some arteries, we call them as arterioles. Clear? So this is how we are going to identify. Now see, what are you going to see? The branching or vessels on the heart. This is an artery which you are seeing here. The branches of the arteries which is present in the heart, which you are seeing here, we call them as coronary arteriogram. And this is a normal coronary arteriogram. In here you can see that there is an obstruction or block. This is narrowed, the lumen of it, because of something accumulated in here, and blood cannot flow through it. The individual may be experiencing pain in the chest while walking or doing something. So this is how we are going to see that blocked coronary artery. It should be looking like this. So this is what kind of X-ray? Plain X-ray? It's a spatial X-ray. Clear? See that? So everything is visible. So CT angiogram. So you are taking a CT scan or MRI along with the dyes, and you are taking it. So it could be CT scan with the angiogram. It could be CT scan with the bronchogram. So we call them a CT angiogram, CT bronchogram, MR bronchogram, MR angiogram, based on what kind of visualization you are doing. X-ray, just arteriogram, bronchogram. If it is a CT scan, further clear picture you are going to get. So more pixel you are adding, you are getting better pictures. How about how much pixel cameras you have in your phone? 30 MP, 40 MP, 60 MP, likewise, you get a clear pictures, updated versions of it, right? So this is with this technology we are seeing. These X-ray plates, whatever you have, these are all plain X-rays. That means nothing special you are looking. So whenever you are reading it, plain X-ray or special X-ray. Then view, what kind of view you are looking at. Then region, on the region what you are seeing. That means bony X-ray, bony part, joints, then soft tissue shadows. Soft tissue shadows, lung shadows and mediastinal shadows. Mediastinal shadows, cardiac borders, lungs, bronchovascular margins and CD and CMs, apex and base, diaphragm,